The number of cyber attacks that use COVID-19 to lure victims has spiked across industries by more than 100 times from March to April this year. Top on the list of hackers is the healthcare sector. It saw a surge of attacks by almost 200 times in the first 4 months, according to one cybersecurity firm. Geraldine Yap with more.
As COVID-19 wreaks havoc in the world, other viruses are lurking in cyberspace. Data from cybersecurity firm Ensign Info Security shows that cyber attacks using COVID-19 as a lure have surged across all industries. The healthcare sector is the worst hit, scoring a 182-fold increase for phishing attacks in the first 4 months this year.
The healthcare sector actually holds a lot of personal data and medical records. And this kind of information can be very lucrative for the threat actors. Some of these healthcare sectors may contain some sensitive information about the treatment strategy for COVID-19. Maybe some of these healthcare organizations, they are also doing their own research into the treatment options or the vaccines for COVID-19. And some of this information, some of this intellectual property can be very attractive to the threat actors.
Experts say the healthcare sector faces challenges in securing its networks. That's because a large number of medical devices are connected to the internet. And while smart technologies help professionals do a better job, they also introduce more room for cyber attacks.
Healthcare systems are complex. So if you look at the entire chain of healthcare delivery, many different types of clinical systems, administrative systems, financial systems are in use. So certainly all of these systems and the processes of handling them and the information are exposed to cybersecurity threats. The healthcare providers are under tremendous stress. So naturally, there is a chance that for our healthcare workers, they may, in a sense, let their guard down for cybersecurity.
But since technology use can only intensify, Mr. Khoong says it's probably time for the healthcare sector to think differently about cybersecurity.
We have to always look at ways in which, as we look at the benefits of a technology investment, we build security into the design of the technology solutions. We should never leave cybersecurity as an afterthought. Very often, the risks that we face come when it's an afterthought that, we discover something here or there after the solutions have been deployed and after we have actual doctors and patients using those solutions.
What this means is healthcare professionals will need to ramp up their instincts for cybersecurity. And Mr. Khoong says it's education, as always, that will go a long way.